Steroids causes.
Okay. They increase your sugar.
Sugar.
They increase your sugar, but that doesn't have anything to do with it. Corticosteroids are ulcerogenic. They cause ulcers, right? So you want to coat the stomach, right? Coat the tummy. Okay. After assessment of laboratory work, the physician orders 2 units of packed red blood cells for a patient. The nurse knows that the test the physician used to assess the need for red blood cells is what? Blood glucose, electrolytes, hemoglobin and hematocrit, or specific gravity? H and H, right? A nurse is making a home visit to care for a patient with chronic obstructive pulmonary disease. When she arrives at home, she finds that the couple has a big box of medications all mixed together, and some of them are outdated. The first priority should be to what? Examine all the labels and determine which ones are still viable. Question the couple to see what medications they are taking. Report the situation to the supervisor so that they can contact the physician immediately. Contact the social worker to begin placement proceedings for the couple. So you want to examine all the labels to determine which ones are still viable?
Yeah.
How do you know?
No, I thought you were supposed to ask them what they were taking, but they probably don't know because they all mixed up.
So it'll be 3?
Report the situation to the supervisor so that they can contact the physician. The first thing is the physician needs to know to verify any needed scripts. The nurse is going to give a subcutaneous injection to a 42-year-old patient of average weight. The needle length and gauge that the nurse will use will be what? A 19 gauge 1 inch, a 22 gauge 1 inch, a 24 gauge 1 inch, or a 25 gauge 5/8 inch.
25.
25 gauge? That is correct. The correct size is a 25 gauge.
And you said that's for sub-Q?
That's for sub-Q. Remember, the larger the number, the smaller the needle, right? To assess therapeutic effectiveness of an anti-Parkinsonian drug, the nurse will observe the patient's what? Increased sleep patterns, increased ability to ambulate and speak, decreased emotional stability, or decreased caloric and nutritional intake.
I think it's C.
I'm gonna repeat the question. To assess the therapeutic effectiveness of an anti-Parkinsonian drug, the nurse will observe the patient's what? Increased sleep patterns, increased ability to ambulate and speak, decreased emotional stability, or decreased caloric and nutritional intake.
B.
Increased ability to ambulate and speak. Who says B? And who says D? The answer is B, increased ability to ambulate and speak. The effectiveness of an anti-Parkinsonian drug. Always remember, when you're talking about the effectiveness of a drug, know what that drug is treating, okay?
Yeah.
So when we're given a drug for Parkinson's, the therapeutic effect is what we're looking for, right? What's desired for the patient. The patient is going through withdrawal from alcohol. Which medications would be treatment of choice to ease delirium tremens? Valium, B1 and B23 and folic acid, aspirin, calcium, and Tigan, vitamin C, aspirin, and calcium, B1, B2, and aspirin.
So the first one?
Valium.
First
B1,
one.
B2.
Valium, B1, B23, and folic acid. Yeah. A patient with emphysema is taking a bronchodilator. Which instructions or statement would be appropriate for the nurse to give the patient? Increase fluids 2 to 3 liters per day. Take medication with food. Slow release tablets may be chewed. Antibiotics decrease the action of these drugs. Patient with emphysema taking a bronchodilator. What instructions or statement would be appropriate to give the patient?
Can you re-say them, please?
Increase fluids 2 to 3 liters every day. Take the medication with food. Slow release tablets may be chewed, or antibiotics decrease the action of these drugs.
I think it's the first one.
It's the first one. Increase fluids 2 to 3
Decrease
liters.
secretion?
To help thin the secretions and to prevent dehydration. A patient taking Dilantin for several months and her seizures are well controlled. Which statement indicates the need for further teaching? I understand that I need to continue taking folic acid supplements. I cannot wait to stop taking this medication. I take my medication with a glass of orange juice every day. I always wear my identification tag. I can't wait to stop taking this medication.
Wait.
The patient is taking Dilantin for several months and her seizures are well controlled. What statement is the need for further teaching? And it's, I cannot wait to stop taking this medication.
Yeah, because they'll be on that medication for